everyone. My name is Mehwish Aftab. My name is Pakizur Rahman.
My name is Aman Khan.
And we will be presenting on the topic neuropsychiatric hospital, planning, design and sanitary requirements. So a neuropsychiatric hospital provides diagnosis, treatment and rehabilitation for patients with mental and neurological disorders. This requires a calm environment, safety and proper zoning. The main focus is patient comfort, safety and rehabilitation. Next we have choice of site. This must be located away from noise, pollution and industrial zones. It must be situated in quiet, green, elevated areas with good drainage. It must have easy access for patients and families, and also non-stagnant groundwater and safe soil conditions. Next we have territory and area requirements. They must be large fenced area with green zones, about 40 to 60 meters square per bed of total area, must be divided into medical, administrative and economic zones, and also must have separate pedestrian and service routes. Next.
Akiza.
Now we will talk about types of building. We have centralized buildings, all units in one main building. We have pavilions which separate building for patient categories. Mixed, which is combination of centralized and pavilion. Preferences, mixed or pavilion for better isolation and access. Functional zoning. Treatment zones, which includes ward, therapy, consultation zone. Diagnostic zone include EEG, imaging, lab. Administrative zone includes offices, records, staff room. Rehabilitation zone includes occupational therapy, recreation and gardens. Wards and patient building. Separate for acute, chronic and observation cases. 25 to 30 beds per ward building. To separate unit for male and female patient. 1 to 4 bed to ensure privacy and calm. Auxiliary and service building. Kitchen and dining hall, laundry boiler and disinfection unit. Mortuary, separate isolated access. Ambulance garage and staff quarters.
Good. Next.
Principle of placement. Building position for sunlight, close ventilation, therapeutic block near central area, rehabilitation and recreation facing gardens, no crossing of clean and contaminated roads. Natural lighting. South and south east facing window, a window to floor ratio 1:4 to 1:5. Maximizing daylight to mood improvement. Avoid direct glare using curtain shades. Artificial lighting and ventilation. Soft uniform white lighting. Night lamp for patient observation. Natural plus mechanical ventilation for fresh air. Avoid noise and draft. Conclusion. Proper site, zoning, lighting and ventilation create a healing environment. Design should promote safety, comfort and rehabilitation. Well-planned hospital improve recovery and staff efficiency. Thank you.
Okay. Thank you.
My name is Wasim Akram.
And myself Sohail Khan.
Myself Nazmul Haq.
Myself Sahih Khan. We are here for presenting our presentation, and the topic of our presentation is Infectious Disease Hospital, their design, structure and planning principles. So let's start from introduction. Infectious disease hospitals are specialized medical institutions designed for prevention, diagnosis and treatment of contagious disease. They must ensure isolation, infection control and efficient patient management. Choice of site. Located outside densely populated areas, downwind from residential zones, elevated or well-drained land to prevent waterlogging, away from industrial pollution sources, good road accessibility for ambulance and supplies. The next, territory requirement. Separate zones for administration, medical, utility area, minimum 25 to 40% green, areas for ventilation and aesthetics. Proper fencing and restriction entry, waste management and disinfection area zone.
Please.
Type of building. Pavilion type, block type, mixed type and each design ensure proper isolation and ventilation.
Now we start various building and their purpose. Admission and diagnostic building, and second isolation ward and intensive care unit. Third one is laboratory and disinfections building. 4 administrative and staff housing. Fifth one is utility block like laundry, kitchens, and waste disposal. Administrative buildings, offices for hospital management and staff coordination, record keeping and patient registrations, conference and training room. Isolation ward. Each ward accommodate one type of infection like separate entrance and ventilation system, air-lock system and negative pressures rooms, easy access to nursing station and treatment rooms. Diagnostic and laboratory facilities, equipment for bacteriological, virological and biochemical testing, strict biosafety and measures, disinfection, chamber and waste segregation.
Now I will tell you about utility and service areas, laundry, sterilization and waste treatment, kitchen food with the controlled food distribution, storage and maintenance workshop. Now principles of placement, minimum 25 meter distance between patient buildings, orientation according to wind direction and sunlight, isolation units on downwind side, emergency exits and accessible pathways. Internal zoning, green and contaminated zone strictly separated, one-way movement of staff and materials, clear signaling and color coding for safety. Natural lighting with windows facing south east for maximum daylight. 1:5 windows to floor area ratio recommended. Prevents growth of microorganisms, improve patient recovery and staff efficiency. Now my friends, I will tell you about more.
Okay, good. Next.
So next is artificial lighting. Uniform and shadow-free illumination, 200 to 300 lux in wards, 500 lux in operating areas, use of UV lamps for disinfection and emergency backup system required. Infection control considerations, separate air handling for each ward, hands-free door mechanism and sinks, surface materials that are easy to clean, control patient and staff movement. Then conclusion. Infectious disease hospitals are designed with special attention to isolation, ventilation and infection control. Proper site selection, zoning and lighting significantly enhance safety and efficiency of patient care. Thank you.
Okay, good. Please.
So hello everyone, my name is Anas Riaz Khan.
Hello everyone, my name is Prajwal Dapre.
Hello everyone, myself Sheikh Ali.
Okay.
So today we are here to present the topic therapeutic hospitals. First we will discuss about introduction. So first is hospital provide treatment, prevention and rehabilitation. Hygiene ensures safe conditions for patient and staff. Prevents hospital acquired infections. Next is the basic definition of therapeutic hospitals. Therapeutic hospitals is a medical institutions for diagnosis, treatment and recovery for patients under hygienic conditions. Next is the main functions. First is diagnosis and treatment of diseases. Second is prevention and nosocomial infections. Third is nursing and rehabilitation care. And last is research and teaching activities. Next we will discuss about classification of hospitals. By functions, it is classified into general and specialized. By ownership, government and private. By stay, inpatient, outpatient and daycare. By capacity, small, medium and large. Location requirements, clean, elevated, well-drained area. Second is away from industry, noise, easy transport access, reliable water and electricity. And last is protected from flooding and dust. Next is.
So next one is site planning. First one is medical zone. It's include wards, OPD, surgery. Second one is economic zone, kitchen, laundry. Third is infectious zone, isolated area, sanitary protective belt, 25 to 50 millimeter green buffer. Types of building systems, centralized, all under one roof. Pavilion, separate buildings, mixed combination. Hygienic demands, ventilation, sunlight, safety, fire exist. Main hospital departments, admission department, therapeutic and surgical departments, maternity and pediatric units, diagnostic departments, labs, imaging, auxiliary services, pharmacy, kitchen and laundry. Admission departments, hygiene, registration, examination, sanitation, disinfection and bathing of patients, isolation of suspected cases, rooms, wetting, sanitary infection, dressings and disinfection.
Therapeutic ward and requirements: 6 to 8 beds, optimum 4, 7 to 8 meter square per bed, bed space 1 to 1.2 meter, temperature is 18 to 20 degrees Celsius, humidity is 50 to 60 degree, light window 1/5 of floor area, daily cleaning and ventilation. Sanitary and epidemiology control is sterilization of instrument, disinfection of air and surfaces, food and water hygiene, waste segregation and disposal, staff hygiene and checkups. Waste management is class 1 non-infectious, class B infectious, class C hazardous HACCPs. Disposal, incineration, autoclaving, chemical disinfection, safe burial. Conclusion is a hygienic therapeutic hospital ensures safe treatment, prevent infections and promote recovery. Thank you.
Thank you.